Cashstat USMLE style question on G6PD deficiency. A 25-year-old African-American male presents to the emergency department with dark urine and jaundice. He recently recovered from a urinary tract infection for which he was prescribed trimethoprim sulfamethoxazole. He denies any history of anemia or similar episodes in the past. Physical examination reveals pallor and mild scleral icterus. Laboratory findings are as follows. Hemoglobin, 8.5 grams, normal 13.5 to 7.5 grams. Reticulocyte count, increased. Total bilirubin, got increased. Direct Coombs test, negative. Peripheral blood smear, Bite cells and Heinz bodies. G6PD activity assay, low. Which of the following best explains the pathophysiology of this patient's condition? A. Autoimmune destruction of RBCs due to IgG-mediated hemolysis. Defective hemoglobin production leading to abnormal RBC morphology. C. Deficiency of an enzyme required for maintaining reduced glutathione. D. Membrane cytoskeleton protein defect leading to increased osmotic fragility. E. Impaired DNA synthesis due to folate deficiency. Deficiency of an enzyme required for maintaining reduced glutathione. Explanation. This patient has glucose 6-phosphate dehydrogenase, G6PD deficiency, an X-linked recessive disorder that increases RBC susceptibility to oxidative stress, leading to episodic hemolytic anemia. Key pathophysiology. G6PD is required to generate NADPH, necessary to regenerate reduced glutathione, GSH. Without GSH, RBCs are vulnerable to oxidant stress, e.g., drugs, infections, fava beans. Oxidative damage leads to denatured hemoglobin, Heinz bodies, and RBC destruction, Bite cells seen on smear. Common triggers of hemolysis. Drugs, sulfa drugs, e.g. TMP-SMX, antimalarials, e.g. primaquine, dapsone. Infections, most common trigger, fava beans. Key laboratory findings, Bite cells and Heinz bodies due to RBC membrane damage, indirect hyperbilirubinemia due to extravascular hemolysis, increased reticulocyte count, compensatory response. Negative Coombs test, not autoimmune. Low G6PD activity, though may be normal during acute hemolysis, requiring repeat testing later. Why other options are incorrect? Option A, autoimmune destruction of RBCs due to IgG-mediated hemolysis. Describes warm autoimmune hemolytic anemia, which would have a positive direct Coombs test. Option B, defective hemoglobin production leading to abnormal RBC morphology. Describes thalassemia, which presents with target cells and microcytosis, not episodic hemolysis. Option D, membrane cytoskeleton protein defect leading to increased osmotic fragility, describes hereditary spherocytosis, which presents with spherocytes and a positive osmotic fragility test. Option E, impaired DNA synthesis due to folate deficiency, describes megaloblastic anemia, which presents with macrocytosis and hypersegmented neutrophils. Thus, the correct answer is deficiency of an enzyme required for maintaining reduced glutathione.